Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where healthcare workers come to be seen and heard, and this is where we get to be human beings, not doing machines. Now, today's episode is going to be about really focusing on our physical being and our physical health, and I want to spend some time sharing just some personal experience of maybe some not so great ways to take care of yourself. And really, we need to focus on this year, I think, very, very much because health is wealth, right? And so if we are not paying attention to our own health, then we really are not going to show up in the best way. And by the way, some of the things that we ignore, we may not get to show up the next day and might actually be fatal in some way. And so we know when something's wrong, but we have a very, very wonderful skill of ignoring it and being on autopilot and disassociating and disconnecting from ourselves and who we are. And so the thing, again, I want to really focus on health as wealth, and this is our well-being long term, and getting to do all the things that we're constantly trying to get to, right? We're at work all the time, but we're always trying to get home to our families. We're always trying to get to that vacation. And really, if we take care of ourselves the best that we can, then we're going to have longevity. And, we talk in medicine, right? This is the new forefront of medicine, longevity medicine and regenerative medicine. But right now, the path that many of us are on is a really destructive path that we're going to need all of those things. And we're not going to show up for the rest of our life, really, with a great overall health. And we keep waiting, and we're often delaying things like, oh, well, when I'm done, I'm going to travel, or when I do this, then I'm going to do that. We have all these ties connected to these goals and these time goals. And certainly in medicine, we're always connected to, well, when I graduate college, then I'm going to do this, or, oh, once I finish med school, then I'll be able to do that. And then once I finish residency, I'll be able to do that. Or once I finish nursing school or PA school, I'll be able to do that. But then there's maybe a fellowship. And then you're going to talk about, oh, well, once I do this, and I'll have the baby, and then you have the baby. And then, well, once the kids are older. So we have this key delay of all of the things that we're trying to accomplish. But meanwhile, we're serving all these people, but we're not serving really our own good health. And so I want to talk about that today. So as you saw in the one of the prior episodes, a good friend of ours is physical therapy. And so, we're at dinner, and we've been together about 3 hours, and it was towards the end of the evening, and she said, I'm not feeling so great. I'm wondering because I have an international flight on the end of the week, and I'm wondering if you all think that that's going to be okay. I've been having shortness of breath for 3 months, and I've had chest pain for 3 weeks. And we said, what? Like you can't believe you're having this conversation, because those are all the trigger words that we know, like go to the ER, go to the ER, go to the ER. And this is a medical professional who knows those signs. And we said, do you have leg swelling? And yes, she did. And so what ended up ensuing, we said, like, you need to go to the ER right away, and we're really worried about you. And she said, oh, okay, I'll do it. So in the usual healthcare worker fashion, she goes home, and then she cleans her house, and then she doesn't go to the ER the next morning. She goes and sees her primary care physician, who then is like, you're going to the ER. And as it turned out, very, very unusual. She ended up in heart failure. Her ejection fraction was very, very low, well under 20%. And we still don't even have a good idea of exactly what caused it. But nonetheless, she was admitted. She was in the ICU. She was hospitalized for quite some time. She's now doing well, and it's basically about a year later, and she has recovered, but not without a lot of issues and managing. And mind you, she has a very busy practice, right? She's managing all of these other physical therapists. She owns a business, and so these are the things that we've got to be mindful of. This, if we can wave our magic wand, right, that scenario never would have gotten that far, and it would have moved forward straight to the ER and getting worked up, because we know those words. We know shortness of breath, right? And yes, there's room for that in a clinic setting, but now this is moving on into chest pain. And of course, with women, atypical chest pain doesn't necessarily present in the same way as it does for men. And so, in talking with her, her thought process was, I don't have time for this. I've got a busy clinic. And she went home, she cleaned the house just in case she had to go do other things and she was out of pocket. So, not wanting to be a burden to anyone and not wanting to interfere with her clinic flow and wanting to make sure that her patients and her staff were well taken care of. This is what we have to get out of, because if she drops dead, her plan was to get on an international flight, right? And so she could have easily died in flight or before then. So that is not ringing in our head, and we need to be very, very mindful. Another colleague who is a surgeon, this colleague had done international travel, and 4 days after the travel had pain in the calves and then developed shortness of breath. Okay, everyone watching this who is a healthcare worker, we know the answer to this question, right? It's blood clot and pulmonary embolism, right? This is just what we know, and these are the trigger words that we look for in patients so that we can get to those diagnoses as quick as possible. And she knows the answer to it, but she is in complete denial about it because she has a busy OR schedule. And so it takes a justification from the other surgeons and her colleagues to say, hey, you need to stop. You need to go to the ER and go downstairs. Like, just, we're all on, we'll just do a pause. Let's go get this checked out. And of course, we already knew the answer, but we got our answer. And of course, yes, the imaging did provide that. But the ensuing thing is that she felt compelled. She got treated, right? She got anticoagulation immediately. And in her own mind, it was like, okay, these patients have rearranged their entire lives. And, my issues shouldn't be affecting them in their lives. And sometimes there's grouchy patients, and like, I can't deal with listening to this person complain and moan about, we have to reschedule this. That's not how this works. And so our body is going to quit if we don't help it. And in these scenarios, patients deserve our best. And she was able to go do those surgeries. And I get that. If you saw episode 1, I was that gal who was in a very deep, dark place. And I went to go get help, and both me and the ER physician decided it was a good idea for me to go home so I could go do my surgery the next day. And this is my point. We can't be doing that. We've got to say, look, I'm not in the best place to really deliver and give you, the patient, the best care. And the patients have to be in a place to hear that and receive that. And they don't always do that. They don't. I had a time where I was in the OR and developed a GI bug, and I managed to eke through and got back um, to my office, and I had a clinic afterwards. And there was a patient who had come down from the mountains, so it was a long drive, and they were having a consultation for a cosmetic surgery, not a consultation, but a pre-op for a cosmetic surgery. And I'm like throwing up and I have diarrhea and I'm like sneak in, and the staff is just so upset. They don't, they're so like, the doctor's in the toilet and the patient's here ready to go, but we can't, this is not going to go. And the patient is like, what do you mean you're canceling it? And the patient's husband, actually, we almost had to call security to have them removed, was so hostile. My staff were threatened by this husband of like, you tell that doctor to get out of wherever she's at and get her ass, and I'm quoting the patient's husband, get her ass here now to do my wife's visit, because they didn't want to be inconvenienced of a drive up and back. And I get that, but I could have literally barfed on them or had diarrhea, all of them. And they just aren't able to shift out. They're only in their own moment and they're not listening, but we have to create boundaries for that. I had another time when I was operating, and I developed this very strange rash, and we couldn't figure out what it was. And it turns out it was parvovirus that I had actually got from one of my patients. And so we ended up obviously canceling the rest of my schedule for that day, because we didn't want anyone else to get sick. And the patients were mad. And they were like, well, can't you just wear a mask? Like, no, this is not a good idea. This is an infectious disease that I just need a little bit of time and we'll reschedule you. But they're so angry because they've moved their whole world around it. But we have to be able to come up with a way that patients can really understand we're not in the best place to treat them. And so here's the thing, like, they want what they want because they've made their whole schedule. But if you have a bad outcome, those patients are the first ones to turn around and call the attorney and said, well, she was sick and she had parvo and now I got that and I'm diabetic and now I have all these complications, or, whatever. So we have to be mindful that the patients are only thinking about getting whatever they need accomplished, but we need to be taking care of ourselves. Again, put the mask on before yourself. Put it on yourself before you put it on other people. And so we have to do that. My wife is a trauma surgeon, and we both like to ski. And I'll tell you two instances where clearly what we actually need more than anything is a ski instructor. But she and I both have had separate incidents where we've crashed skiing. She actually had a clavicle fracture, a humerus fracture, and then had a flail chest. As we are getting her, packaged up on the mountain, and we've got to get her down the mountain and then get her over to the hospital, and there's a whole ICU stay and a whole big thing. The overwhelming talk that is going on is she wants me to get in touch with her partners because she doesn't think she's going to be able to be on her 24-hour trauma call the next day. And I said, sweetheart, you're not going to make a call for several, probably months. So we have to heal you. You're pretty broken. And she's like, no. I just need tomorrow off. I'll be fine. And that's kind of the mentality that we have. And we need to really shift out of that. And for me, similarly, I had a ski accident. My ski just came off down on a downhill run, and I launched in Superman and landed face first into the run, and I broke ribs and I had a pretty good concussion. And the problem is that you've got this busy schedule, and we've got to do clinic, we've got to do surgery. And so, like, my ribs are killing me, but my head is not right. And nobody steps in to say, hey, let us take some of this off your plate, let us help. In the clinic, as you all know, electronic medical records, right? So it's all computer based, it's all screen time. So the first thing that we tell our patients with concussions is like, okay, we need to stop all of this sensory stuff coming in, like no screens. And so, my screen time starts in the morning on the phone and then going to the clinic. And then I'm on screens all day because this is what we interact with patients. And then we have to do all of our notes after we finish. And then we have to do all the billing paperwork and all the other accessory charting. That's all on screens. And then I have to be in meetings on screens. And so you're just like, you can't get away from it. And there's no one else. And so if I wait until this concussion has resolved, which would have been much faster had I not done that, you know, I I can I'm gonna not be able to do my clinic. I'm not gonna be able to see patients. And I'm in private practice. I don't have a job that I'm employed. I don't work for the university. I don't work for a hospital. And so I'm not getting a paycheck. I don't get leave that doesn't result in no revenue to a practice. So I'm a business owner, I'm a CEO. So all these things are in play. And these are the things that we have to build in systems for so that we have extra support so that someone else can help us without the whole ship going down. I had another time where um, when I was a resident, I was operating and I had bilateral pneumonia and it was fine. Everyone in the room was fine with me operating with bilateral pneumonia until I ended up started coughing and they're like, you're going to get us all sick and you're going to contaminate the patient. Like that's the moment that everyone else said, you should go. I should have never even gone to that place. And that was totally acceptable. I had another time, and this is a very personal thing. I was pregnant. I was in the OR and I was taking care of a young fella and I was basically replanting a finger and I was 3 months pregnant. And so all of a sudden while I'm operating, I feel this really kind of squishy feeling. And now I like there's fluid, in my pants. And so trying to figure out like, oh, what what's happening. So I paused the surgery and I just tell everyone I need to run to the restroom really quick. And I go and I'm clearly bleeding. And so I call my OB and she says, hey, we need you to come here right now. And I said, well, I can't. I'm actually in the OR right now. I'm in the middle of a surgery. I'm replanting this kid's finger. And so she said, okay, well, you call me as soon as you're done. And as soon as you're done, get over here. And so what's happening now is that, now she and I both know what's happening and I'm miscarrying. And so I've got to get back to this place and rolling up wads of toilet paper, stuffing it in my scrubs so that I can get to this and not be bleeding all over in the OR and get to that, hurry up, finish up that surgery, knowing that I'm losing a child. And I've got to separate from that moment. Meanwhile, this is like devastating. And I can't even get to the medical care that I need because my alliance is to the patient and my responsibility is to the patient, but my real responsibility is to me. And we don't have any backup ways to say, hey, is there someone who we can call who can maybe drop what they're doing and come over and help and get this? That's never the thought process. It's always about, I just need to gut through this and I just need to get through this and then I'll take care of me afterwards because the person in front of me is the most important person. I think we have to get away from that. And I ended up, I left and I went on to miscarry and I ended up having to have a procedure the next day. And so I was even stressed about that because I was having to cancel clinic and where are those patients going to go? We have to get out of that mindset and we really, really have to start paying attention to our health. Health is wealth. And so we have to think about longevity. We have to think about our sleep. If we're not sleeping, we are not cleaning our brain at night. And that is going to lead to dementia. It's going to lead to all kinds of issues. And the problem is that if we're saving ourselves for some other world and life and quality of time with our family, once we finish this role as a healthcare provider, we're never going to get to that. We're going to die out, or we're going to disable out in some way, and we're just not going to be available for them. And or gypping us, right? Because we deserve better. And I think this is some self-worth talk that we have to have with ourselves, that we matter. We matter the most. And everything it is needs to be focused on our own health. And everything else can go after that, because if we're not here, we don't need to worry about someone running the clinic or doing the surgery if you're dead, right? Or if you're disabled in some way. It's just that's not our future that we want to have. I want to make sure that we're eating well. We've got to eat every day, and a lot of us are soothing ourselves with food and alcohol. We have to stay away from artificial colors, artificial flavors, high fructose corn syrup. These are all the things that we know. And yet, I mean, how many people do we see with cans of diet soda and all kinds of processed foods and fast foods, and we're on the go. So we just got to cram something. Like, we've got to stop. We've got to go grocery shopping. We've got to get good food. We've got to make good food and make sure it's our job to provide food for ourselves. We're adults. We do it for our families. We do it for our kids. We've got to do it for ourselves, and we've got to take time to eat good quality food, because garbage in is garbage out. We know that. And we counsel patients on this all the time. How many of us are in unhealthy states? How many people within our own community are not taking care of themselves? And we've got to do better at that. So we've got to eat well. We've got to sleep well. We have to take care of ourselves, the surgical community, who are in awkward positions for long, long hours of the day. We need acupuncture, we need chiro, we need physical therapy, we need all kinds of stuff, massage. We have to remember our body is our temple. And we're trying to communicate that to our patients, but we have to be spending more time with us, making sure that our body, the temple, is well maintained. I want to talk about breast imaging, because, of course, this is something that I do every day. We see breast cancer all the time, and we're seeing people younger and younger. And why is that? Well, certainly genetics play a role in that, but there are certainly other environmental things that are probably in play as well. The insurance companies are going to dictate healthcare, but we don't have to accept that, and we know better. So we can get imaging whenever we want, and maybe the healthcare insurance companies they're not going to pay for your MRI or your mammogram or whatever because of your age. It doesn't matter. We know better. We know the answers, and screening is winning, right? So the more that we know ahead of time, the earlier that we catch things, then why are we not doing it? We have to take time. We've got to take time out of our schedules to do that. I can't tell you the number of healthcare workers that we see that are not getting their annual imaging. And we've got to change that, because having practitioners show up with stage 4 cancers, that's not the win. Like, we have the access to all of the most advanced healthcare of all the people in the world. We healthcare providers have access to it. It's right here. We just have to literally show up and go do it. So we have to do it. We owe it to ourselves, and we owe it to our families, because they're expecting us to be around for a long time, and we have to show up to do that. The other thing is, guys, go get your prostate checked. Make sure that everything is checked with that as well. And then the other thing is, we've got to check our hormones, because the environment is changing us. We've got to make sure our thyroid is working well. We have to make sure we're not pre-diabetic. We have to make sure that our estrogen and progesterone and testosterone are working the way that it's supposed to. We want good qualities of life, and we look at regenerative medicine and longevity medicine, which this is all part of. But we have to participate in that, because we are not immune to any of these things. We're not immune to cancer. We're not immune to trauma. We're not immune to other illnesses and autoimmune things. Like, we're just regular people. And just because we work in healthcare doesn't mean that we don't get sick. And so we have to protect as much as we can against those things. Getting your blood work done annually. I mean, that's easy, even when you're young. And whoever wants to criticize on that, there's young people with disease. And there's easy, simple tests to check. And I'm not saying if you're 25, but really, we need to start screening people earlier. And it's not just for, big cancer stuff. Like, let's just make sure that you're optimized, because we spend more time and effort and certainly money on our cars, on the maintenance of our cars. And if I told you today, you only get one car, like from today on, you only get one car for the rest of your life. You don't get any more, and you don't get any extra parts. Like, you just have to make do with what you have. I feel like that's a little bit frightening. And, I'm a race car driver, so I have many cars. So just limiting it to one. Now think about the year you were born, and that's the year model that you get. And so now you're going to get a used car, and how good a quality is it? And what's the maintenance of it? We have to treat ourselves like that. Like, we only get one vessel. This is it. This is one body for one life. And so we've got to treat it better than we do our cars. So let's work on that. Now, the last thing I want to talk about is genetic testing. And I think this is something that's very prominent in my world. You can do cancer screening. There is cardiology screening as well. Lots of genes that are detectable that give us an early warning sign of like, hey, look, you need to pay attention to these things. And maybe there's some therapies that are indicated. Maybe there's some surgeries that are indicated. But certainly we know about this. Remember, knowledge is power. We tell our patients this all the time. Knowledge is power. So the more that we know from a genetic standpoint, the more that we can do proactively to know, like, okay, we know that there's the possibility of a problem. This is the percentage that we think it might be. Okay, do we want to do a procedure? Like in my world, BRCA genes and all of the breast cancer genes, maybe we're talking about mastectomy. We don't want to hear those things, but you know what? What we also don't want is the side dish of chemotherapy and radiation that we wouldn't have necessarily had we focused on dealing with this. Now, there's lots of other things that we find that are simply surveillance. But again, knowledge is power. If I know something's changing, then we can begin to do therapies much, much earlier. But I feel like we as a community have a tendency to just say, look, I'm not going to, I'll deal with this when it happens. And we kind of stick our head in the sand. And I feel like we have access to all of this. Now, this genetic testing, I have my patients do it. It's like $250. And you don't have to go anywhere. Like literally while you're laying in bed at the end of the night, you can go online and order these, send it, it comes to you, you swab your mouth and you send it back. Like it literally takes there's not even a visit. And there is a geneticist on the other end of this once you get your results. So these are things this is all the knowledge that we have that we're not taking advantage of. So I really want to say, I want to hug you all and tell you all, look, we can do better. And our health is the most important thing because we have to show up for us. No one's coming for us, right? No one is coming but you for yourself. And we all have to work together and we have to support each other. And when I know that a colleague has to go like, hey, look, go get your mammogram. I'll cover the pager. Just like, go get it. Go do what you need. We have to support one another. And when we hear these things, we have to say, no, that's not right. You have to take care of you. Make time, change a shift, do whatever you have to do, but you have to go do these things. We have to support one another in this. And this is the community that we're building every day right here at Soulful Surgeon. We have to do this. The healthcare community has to support one another and we have to be there. I'm your sister. You all are my sisters and brothers and we have to do this together. So please take care of one another. Thank you so much. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.